Hello and welcome to my friends and hardworking associates in Sacramento, and particularly to Speaker Rivas for all you do. My name is Doug Major from the California Children's Vision Now Coalition. I'd like to provide an overview about a vision screening we've done in your district at the start of the school year. You're probably aware of that critical link between vision and learning, and you're all a lot of information or ideas of improving literacy, as in AB 1454 suggests. We want to show you a gap that a targeted legislation could fix for children's vision care. We made this open to everyone, boots on the ground. You had a number of staff members that came from the county as well as the Senate and Assembly in this cool Art Deco school at San Ardo. This is just an overview of that screening. This was provided sort of free of charge from the SL Lion's Eyes organization. We've been doing this since the 1960s, as well as an advocacy team from Cal Poly, exciting young students. And so what did we do? A screening took place at the school, including all the children available, almost 80, and we used the modified clinical technique. This is the gold standard for screening with a very high sensitivity and specificity rate. It's really doing a diagnostic exam on site. Please note that the students had already received their yearly ed code exam from the county nurse. This test is fun and fast, but requires a licensed eye doctor that's skilled in this area. So I'd like to introduce you to the California Children's Now Coalition. This is a group dedicated to improve eye health with policy advocacy, education, and outreach. This represents every branch of pediatric eye care, as well as all the optometry schools, nonprofits Vision to Learn, Children's Now. We're not a professional organization. We're not a PAC. We are simply your voice for children's needs in vision care. So the screening was done in the early morning with this Lions Club testing van, which was transported courtesy of King Oil in San Ardo. This is a community effort, covered all the students to establish a clear baseline, and we were interested to see what the needs we'd come up with. Well, we came up with some very difficult statistics. More than 60% in some of the classes had a vision disorder that was undetected, predominantly something called astigmatism, we'll address later. Of those who didn't have astigmatism, most already had glasses, treated by the traveling nurse and were under care. But we did catch a few others, but the majority, if not all except two, had this astigmatism. And so what's the impact with all these students not passing this vision screening? There's a huge amount of educational implications. Of course, the poor vision affects literacy, special education referrals, lower test scores, increased dropout rate, and just this particularly with the type of disorder we discovered, astigmatism. Uncorrected astigmatism has a genetic component, so very common in Latino and tribal children, can reduce reading speed by half. So this is even more problematic as the child gets older and the print gets smaller. So these children, obviously they pass the visual screening test for acuity only by squinting and identifying a few of the numbers, but this is a problem because after a while they are slow, they think they're not good at school, according to research by Harvey. However, when correcting the astigmatism, their reading fluency improved to a grade level compared to the non-treated child. This is so easy to fix according to research. So here's a legislative call to action. Update the statewide vision care policy. You might be surprised it's hard to do because there's no basic public health data collected or distributed to managed care groups or others to support these children's academic success. Unlike dental care, there's pages of surveillance metrics. Last year, we had a bill go through council, the Children's Vision Care Public Health Metrics Act. We've been working closely with the Department of Healthcare Services and their public health management group. We think that this shouldn't require legislation, but it hasn't moved in the last 2 or 3 years. We need your help. And why? Because we are the worst in the nation. California, we brag about so many cool things we can do here. This is one area we're worse than the nation, and this affects our future success. They call it the USC study of a visual imperative to treat these children. I did give your staff members some astigmatism glasses so you could personally appreciate what these children are going through. you stimulate astigmatism, you can really, it impairs your literacy right away. There's some interesting new statistics showed that since the pandemic, there's increased number of astigmatism diagnoses, as well as this idea that done by, studied by UCLA that Hispanic kids have the most burden on this, causing them a problem. And these are conditions that don't become later in school year. These are children that arrive in kindergarten with this disability. So here are the conclusions. Vision health is obviously fundamental to learning. We urge you, Speaker Rivas, as well as your team, to become a children's vision care champion. I know you've voted for similar bills in the past. We need to update this so we can ensure equity for all children, and particularly the 5.4 million under the care of the Department of Health Care Services. Give them a clear path to learning. Here's an afterthought. Obviously, after identifying these children, we can't just leave them there. We will be going and doing with a nonprofit work, providing glasses to those children at no charge to state. And those who think this might just be a rural problem, think again. Former LA Unified Superintendent Austin Buhner went with his nonprofit to San Mateo County and found in some schools upwards of 180 untreated children. 180. And this is just one area in the state. This is a statewide problem. It's a catastrophe. It's unequal to our vulnerable children. And it's time to fix that. And our coalition is here to help. We are here to provide any guidance or help. We have some of the best in the nation. Let us use our expertise to address this issue for lack of children's vision care. And thank you so much for your attention.